wildlife rescues and rehabilitation, and treated displaced and injured wildlife such as sloth bears, leopards, elephants, tigers, reptiles, birds, and many more. And today, Dr. Shah is going to be presenting on health and disease management of sloth bears. So Dr. Shah, please share your presentation. Thank you.
Very good morning to everyone. Thank you so much for the opportunity given to me by Asian Elephants and Heidi Riddle and then Life Trust India, Dr. Daniel. So I just wanted to share my presentation. Is my presentation on a full slide mode?
Yes, sir. Yeah.
So once again, a very good morning to everyone, and thanks to the organizers. Here I am going to talk about health and disease management of sloth bear. And in this beginning slide only, I would like to give some basics about sloth bears, and they are called as Indian bear. They are Myrmecophagous bear species native to Indian subcontinent, and it shares features of insectivorous mammals and evolved during the Pleistocene from the ancestral brown bear through divergent evolution. So the sloth bear is the most widespread bear species in India, where it mostly occurs in areas with forest cover, low hills, bordering the outer range of the Himalayas from Punjab to Arunachal Pradesh. It feeds on fruits, ants, and termites, and it is listed as vulnerable in IUCN Red List, mainly because of habitat loss and degradation. And in Indian Wildlife Protection Act 1972, it is a Schedule 1 species. And sloth bears breed during spring and early summer and give birth near the beginning of winter. And they often give 2 to 3 cubs at the max, and they don't hibernate, unlike our other bear species. 2 subspecies are there predominantly in sloth bear. One is Melursus ursinus. The other one is Melursus ursinus inornatus, which is found only in Sri Lanka. So in Sri Lankan sloth bear, they're phenotypically they are very smaller, and then basically their skull is smaller with a low length of condylobasal area, which will be more in males and which is little lesser in females. And it has much shorter body hair and sometimes lacks the characteristic white blaze mark on the chest, which is very much predominant in Melursus ursinus, and which is available in the whole Indian subcontinent. So I really would like to acknowledge all my teachers and mentors, all my State Forest Department, where we were part of the projects, and they have given us a collaborative effort to look after these rehabilitated bears, especially in the part of Uttar Pradesh, Karnataka Forest Department, and Madhya Pradesh Forest Department, Maharashtra Forest Department, Chhattisgarh, and Tamil Nadu Forest Department. And of course, my parent organization is Wildlife SOS, and vet colleagues, especially Dr. Ilayaraja and Dr. Ashwarendra Singh and Dr. Sriram and Mr. Srinu, and all my vet colleagues, and especially the animal care staff. I really would like to acknowledge for all the efforts, and also the effort they put in giving upkeep of these animals, and we learned a lot through all of them. So I just wanted to start with my captive wildlife welfare slide, because the theme is basically a captive wildlife welfare. So I just wanted to touch upon the subject of captive wildlife welfare. It means physical, emotional, and environmental well-being of wild animals in captivity. So as we all know that unlike the free-ranging wild animals, captive wild animals have got a lot of restrictions because they are in a controlled environment. So it is very much important for us to understand their behavior, and they have to lead a healthy and stress-free and naturalistic life and to improve their quality of life is very much evident and important with respect to captive wildlife management or welfare. So the primary goal is the species conservation, and the captive wildlife, as we all know, serves as educational awareness tool and research subjects to better understand animal behavior and needs. So based on that only, we can definitely improve the captive wildlife welfare, and eventually the results of the species will be definitely the species conservation effort will get into a better shape. And we must provide utmost care to these wild animals in captivity, and there should not be any harm to them, especially with respect to their behavior as well as their health. So I would like to talk about this in one more slide, the aspects of wildlife welfare in captivity. So there are major four aspects when we talk about wildlife welfare in captivity. The first one is the health. So that represents through regular veterinary care, disease prevention, and nutritional support. And the second important point is the enrichment, which is an environmental enclosure enrichments, provides opportunities for natural behavior so that they will be always given kind of freedom or even expressions to show their natural behavior, like playing, foraging, and social interactions. So the third important aspect is the space and environment. The adequate space that mimics natural habitat, clean environment, and comfortable enclosure. So those are really mandatory if you are really interested in addressing any welfare within the captive animal facility. So the fourth a very important aspect of the wildlife welfare in captivity is mental and emotional well-being. As we all know, all animals are sentients in nature. So we need to address that part by providing a better mental and emotional well-being to avoid their stress and anxiety and boredom through enrichments and proper social structures. So these four components are very important aspects of wildlife welfare in captivity. So coming to the next part is the principles of captive wildlife management. So this, in a nutshell, we can bring the entire aspects into a major three principles, which is very important for the captive wildlife management, which are health, nutrition, and enclosure. So with respect to health, we all know that the regular health monitoring and checkups, being a vet, we will be more emphasizing on these aspects of health and preventive medicine. As we all know that prevention is always better than cure. And the vaccination and deworming procedures are very, very important to keep their health up to date and to avoid any kind of stress because of any kind of physiological or even psychological related activities or even situations. So the other part of the health is choice of antibiotics, the antimicrobial for specific organ system infection. So for example, if it is a respiratory related issues, we have to identify a specific antibiotics, especially through their samples, and then culture and microbial sensitivity test for antibiotics would be always a better choice instead of just randomly using antibiotics of higher grade and then get into a problem of microbial resistance. So it is always important and very, very evident that the judicial use of antibiotics or antimicrobials are very important. So if we can conclude the problem areas, as I said, whether it is respiratory or GI or reproductive or skin or dental or ocular, so depends on the specific organ system. If you could select the antibiotic, it will be more sensitive and more specific, and we don't need to use indiscriminate antibiotic regimes in any captive wild animal. And of course, the prophylactic measures like even hygiene and then the preventive care and then biodisposals and biosecurities, all those things are very important. So those are primarily comes under the prophylactic measures, which includes even our quarantine protocols. So the second important principle is the nutrition. We always emphasize on species specific diet, considering gender and age. So which is very integral component of this captive animal management. And the feed supply to animals should meet nutritional and functional needs, because as we all know that nutrition in wild animal was not so established, because it is very difficult to conduct any experiments or even to do some kind of controlled environment, or even making a metabolic cage studies. All those things are literally difficult. I mean, at least in India, if I am not wrong. So it is very, very important, and we should give emphasis on the natural feeding or foraging behavior of the wild animals representative species in order to get some kind of scientific approach towards the nutrition in captive wild animals. So the feed supplements to address nutritional deficiencies or specific requirement is also a very integral part of this captive animal nutrition, because many at times we will not be able to address all the nutritional requirements with a given food, because many times our food choice will be based on the locality and based on the available foodstuffs and based on the economical situation of the particular facility, whether it is a zoo or aquarium or even a rehabilitation center. So it has got a lot of components, I mean, parameters to give constraint to address this adequate food supply. So a vet should definitely give importance to add some kind of nutritional supplements to avoid any kind of deficiencies. It may not be a direct deficiency, or it may be an indirect deficiency. So nutrition plays a major principle with respect to captive wild animal management. The third important principle is the enclosure. As we all know that the enclosure has got a lot of standards, and then every province or even every country might have their own regulations to give a minimal standard space requirement for each and every species. So with respect to that, especially in India, we have a Central Zoo Authority which governs all the captive animal facilities with respect to their enclosure, or even the health and nutritional based SOPs and guidelines are provided, which is always available online. So any vet within our country can definitely take guidance from the CZA manuals, or even their blue books, to check their standard housing measurements, and also how much space is required for individual animals, or a pair of animal, or a group of animals. So it has to be followed, not only for the sake of the following guidelines of some authorities. It's definitely to give better quality of life to the species. So it is very important for a vet to understand the importance of the enclosure size in order to get a desired behavioral pattern, or even behavioral expression from an individual species. So especially for sloth bears, they always need more space, and then though they are solitary in nature, but they tend to be friendly with other animals, other gender especially. And when they are in group, they will definitely express and then do a lot of social activities, and also the social interactions, which make them more happier and then reduces their stress level. Eventually, the health will be always upfront and then fine when it comes to any kind of veterinary care. The other enclosure aspect is the safeguarding. So enclosure barriers, if it is a zoo premises, they generally make a moated or even a dry or wet moat barriers, and sometimes power fence, the solar power fence barriers, or sometimes even the chain link mesh barriers, which will be very safe both for the animals as well as the staff, or even the visitors coming to see the animals. And other important part is sanitization and disinfection protocol of this any captive facility is a primary importance if you are trying to control any kind of spread of diseases, or even emergence of any pathogens. Because as we all know that the disease has got three primary components: is the host, the environment, and the pathogen. So to control and keep all these three components in track, it is very important to manage the enclosure very well with a proper sanitation and disinfection, so that there won't be any underlying factors to make the animal ill. The last important enclosure aspect is the enrichment. As we all know that enclosure enrichment and environmental enrichment plays a major role. And there are enrichment itself is a big subject. We can definitely talk for a whole day. But since these principles included this enrichment, so I just wanted to touch upon the enclosure enrichment aspect as well. So when we are entering into this health and disease management of any captive facility, I just wanted to give you a glimpse of those terms so that we will be familiar with that. The animal health means the state of physical and psychological well-being and productivity. So this is something a very simple and then a straightforward statement that the physical and the psychological or even behavioral well-being of the animal is the expression of the health. And whereas the animal disease management means the process of preventing, treating, and controlling the disease that affect animals. So this is the disease management. How are we going to manage the disease? To understand the process of preventing and treating and controlling these components or the disease management. And wildlife health and disease management in captivity is an important part of maintaining the well-being and the quality of the life of the animals in any captive facility. As I said, whether it is in a zoo, an aquarium, rehabilitation center, or in any other controlled environment. Even if it is a conservation breeding center, then we have to have the same kind of rule that it addresses complete well-being and the quality of the animal. Only then the disease will not emerge or disease will not occur into any kind of captive facility. The effective disease management is essential to prevent outbreaks, maintain animal health, and ensure conservation efforts are successful. So this is a small glimpse of the health and disease with respect to the terms and understanding of the disease management. And coming to the common diseases in captivity, especially in sloth bears, so I just listed out few because there are multiple things which may not be common, but it can occur occasionally. But I am going to deal with some of the major diseases which we have encountered and then how we addressed those issues. So it might be practically useful for the captive animal vets in this forum. So out of these common diseases for sloth bears, we have the bacterial diseases of tuberculosis and leptospirosis, and viral diseases like ICH, infectious canine hepatitis, and herpes, and canine distemper, and we had a lot of outbreaks of rabies in our facility. And the other, the very minimal problem is the fungal diseases and hemoprotozoan diseases. And the neoplasm is another common area of the disease in captive sloth bears, not only in our country, across the globe, and we still have got a lot of unaddressed areas with respect to this hepatic neoplasms. So I'll anyway come to that in my particular slide. And the regular parasitic infections like internal or external parasites are also very common. It's easy to deal with, but still we need to understand the dynamics of this parasitic issues in captive sloth bears. And we do encounter some of the hormonal imbalances like even parathyroidism or hyper or hypo, and corticosteroid imbalances also sometimes create some kind of health issues in captive sloth bears. And apart from that, the regular gastrointestinal problems, dental issues, respiratory illness, joint issues like arthritis or even hygromas, and the reproductive issues, even sometimes we encountered pseudo pregnancies and the mammary gland tumors as well. And the common age-old problems are like chronic kidney diseases, hepatitis of either viral origin or even any other infective origin. And a few skin infections were also encountered in captive sloth bear facilities. And coming to this tuberculosis, as we all know that Mycobacterium tuberculosis is the causative bacteria. And then in animals, especially, we encounter Mycobacterium bovis. But in our case, these are all from the rescued background, especially with the gypsies background. So they contracted the disease from people, and then they have eventually expressed the species of Mycobacterium tuberculosis instead of Mycobacterium bovis. So we got to know this through culture examination, and then we literally, I mean, whatever may be the tuberculosis, we have to follow the same TB medications. So apparently, we are doing the same kind of diagnosis and management with respect to control this disease. But the symptoms are very, very specific, like the inaptitude, anorexia, and gradual weight loss, purulent discharge from the eyes and nose when they were really in an advanced disease condition. Especially few weeks before death, we can expect these kind of discharges from their eyes and nostrils, but not very often. We used to find that. And lymphadenitis is another common symptom we always find. All the peripheral lymph nodes can be palpable, but it is very difficult to do a physical examination of any captive animals. But still, when we are doing them under immobilization or after anesthesia, then definitely these are all the very salient features that we can always look for. And diarrhea and deep thoraco-abdominal respiration is very uncommon, but still we will not be able to conclude just because of diarrhea it may be a tuberculosis, because in this species especially, we could not find any such kind of cough or even sputum coming out of the nostril in earlier stages. So we always suspect that the sputum came out of the trachea or even through the pharynx. It might have been engulfed by the animal, and then so through the oral route, or even if something is divided in their fecal content. So we always do a culture and staining process to identify if there are any mycobacterium, because they are very easy to identify through a stained slide. So it's another easy way of diagnosing the mycobacterium if they are voided in the feces. Of course, the PM lesions are very, very straightforward. You can see the pictures on the right side. The lungs are more nodular in lesions and large pus-filled cavities. And if you just put a nick, and you will see the congregation of the pus, and also this the caseous nodules everywhere, and a lot of calcifications because it is a chronic problem, and the congested trachea, and of course enlarged lymph nodes in and around the respiratory system, and pus all over the lung lobe is very, very evident. So it is very easy to identify a TB infected PM lesions when you are conducting a necropsy. And the usual diagnosis and management is just through chest radiography, a lung wash, because we used to put the tube, I mean, through the endotracheal tube, a clean autoclaved disposable tube into the trachea, and then ensure that there are a lot of mucus stuck into the tube, and then we put normal saline of 40 to 50 ml, and then immediately suck them back, so that this lavage will definitely carry some kind of bacterial load. And then we can easily get the diagnosis done through either staining or through culture. So the blood work is any disease diagnosis process, we always get into a basic blood work. But with respect to tuberculosis, it is not much evident. You will not be able to find the tuberculosis just by doing blood work until or unless it has become very acute or even a miliary condition. Otherwise, the body makeups everything, and then you will not be able to get any hemogram changes. And the other easily available test kit is the Wild TB Alert Kit, which is very easily available, and then it's a tabletop test. We can easily do a Wild TB Alert test kit with a drop of blood or serum or even plasma, and then the reading will be done in less than 1 or 2 minutes. So based on the symptoms, the treatment will be always an anti-tuberculosis drug, and then monitoring and providing supportive care and treatment is another important factor, and avoid the animal to get into any kind of stress. Even putting them into a squeeze cage or trying to do some kind of intensive treatment by putting them under an isolated area itself is a big stress for the animal. So the stress induces proliferation or even provoking the disease a lot. So it is very important to ensure the animal is stress-free as much as possible. Because isolation is inevitable. So we'll have to manage such things, and then exposing the animal to sunlight also gives us a lot of improvement. And with respect to anti-tuberculosis, drugs are like a combination of four anti-tuberculosis primary drugs called isoniazid, ethambutol, pyrazinamide, and isoniazid, ethambutol, pyrazinamide, and one more is there, the rifampicin. Isoniazid, rifampicin, ethambutol, and pyrazinamide. Yes, four drug combination is available in one single tablet. Then we can go for that for the control of tuberculosis. The second important viral disease is infectious canine hepatitis, which is literally a per acute form we always encounter. And this is a contagious viral disease causing liver infection by this canine adenoviral infection type 1, and they usually have a incubation period of 4 to 7 days. And the symptoms are very, very, very specific, and the per acute cases or forms were only noticed by us so far, and then the death will be very, very sudden and very quick by just showing a convulsion. And by the time you reach the enclosure, the animal would have lost their life. So the respiratory distress was the one and only symptom we found with the convulsion. But in acute cases, the staggering gait, shivering, congested eyes, petechial hemorrhage in lips and gums, as you can very well notice in this image or the picture. And the PM lesions are very pinpoint hemorrhage in all the serous and mucosal layer of intestine, stomach, and all over the mesentery. So coming to the diagnosis and management, infection spreads through urine, feces, saliva, even through fomites. So it is very, very important for us to make them to isolate strictly, and then ensure that steam cleaning or even the flame gun or even quaternary ammonium components are used to disinfect the enclosure on a regular basis. And immediate isolation of the animal is very much warranted. And the supportive treatments with the immunomodulators, hematinics, vitamin C and E as an antioxidant will always help. Coming to the next important viral disease is rabies, and this we know the rhabdovirus, and then the incubation period is 7 days to several months, and the symptoms are very, very unique in sloth bears, whichever the rabies case we found so far in captive facilities are primarily looking like a dumb form of the disease, and they always have a labored respiration distress, pale mucous membrane, and inability to digest or ingest food. So vomition of undigested food material and off feed indicating the dumb form of the disease, and they never been aggressive so far in our captive facility. And then the post-mortem lesions were very, very clear, and then even the histopathology examination of the performed, the brain samples showed negri bodies. And the bear usually be dying once after the symptoms were shown within a span of 3 to 7 days. And the diagnosis is symptomatic, and then it's hard to suspect this disease until or unless we isolate them, and then if they cross more than 10 days to several weeks of quarantine or isolation. Morbidity and mortality was controlled only through immunization procedure by giving ARV vaccines, and post-exposure immunization procedure, and followed by annual revaccination is the current practice in our facility. And then so far we haven't lost any bear because of rabies. The other most important disease in captive sloth bears or carcinomas. So these carcinomas are primarily either gallbladder or even liver carcinomas. And in our case, many of these either gallbladder disease or cholangiocarcinoma always exhibits a bulged abdomen, which is very big ascites, and then the animal stops eating, and then you can see a lot of icteric mucous membrane and even the skin, and then this axilla region, or even the ear pinnas get into a generalized jaundice, I mean yellowish depigmentation or even the coloration all over the body, and facial and peripheral edema according to the severity of the condition we always witness. Intermittent vomiting causing mucoid brownish black scanty feces is another important symptom we always find. In the initial stage, there won't be any marked changes in food intake, but as days progress, the gradual inappetisance and intermittent anorexia will develop, which will lead to lethargy and general weakness. So the non-parasitic allergic dermatitis. So though if we are checking the skin samples or even fecal samples for internal parasites, there won't be any parasites, but still we could see a lot of allergic dermatitic lesions around the lips, limbs, and perianal region were also noticed in bears with hepatic pathology. So it could be a reason the hepatic insufficiency leads to this expression of other extra hepatic symptoms, but still this needs a lot of study because all over the globe, I think wherever sloth bears are there and they are facing such kind of hepatocellular carcinomas with no specific reasons identified so far, except a few gut microbial changes and also the feed related reasons, but still there was no conclusive reports as far as I know. And the dental issues are also very common because, as I said, our bears primarily are rescued from this performing background. So they always have this very bad tooth because they rip off the tooth for their safety reasons. But without that, also in many captive facilities, we always see a lot of teeth related issues like fractured canines or even aberrations or caries in molars and premolars, and also a lot of root canal problems or even pulp exposed, and a lot of carcinomas like gigantiform cementomas and then osteoblastomas, or some of them I mean, isolated and identified and diagnosed in our facilities. And there are a lot of developmental dental disorders like malocclusions and other stuff that are also very prominent in captive sloth bears. And coming to the next few slides, I'm going to talk about this prevention and biosecurity, which is primarily made into four major parts: quarantine procedure, hygiene practices, pest control, and vaccination programs. And here in Bear Rehabilitation Center of Wildlife Research, we always follow 90 days of quarantine facility, and we have structured that into 0 day. The animal should be put in a isolated environment because they are into a new environment, so that we can allow them to acclimatize and calm down and settle with adequate clean drinking water or ORS or even any kind of tender coconuts water, so that the animal will be in a calm subtle environment, so that it will get less stressed, or multiple people sometimes may lead to a lot of stress situations to the animal. So minimal people involvement, and then observing the bear for their behavior is a primary component of the 0th day. And first 15 days we will be observing for any illness, diseases, behavioral changes with respect to their vision, exhibition of pain, external parasites, all those stuffs. And the regular porridge or any kind of regular feeding practices should be slowly introduced to the animal, so that the animal will not have any kind of nutritional shock. And the fruits, because as I said, they are insectivore and also frugivore, I mean, myrmecophagy in nature, so we can introduce a lot of worms, insects, and also a lot of seasonal fruits and vegetables. Careful visual examination for the external body is very important within that 2 weeks. And then from 16 to 35 days, the animal temperament should be recorded based on observation, and initiating oral supplementation along with food. Fecal and urine examination gives us a major point with respect to their food and also their hydration status, and 36 to 45 days anthelmintic administration like any of these drugs like albendazole, fenbendazole, or praziquantel, ivermectin, doramectin. So any of these combination will be used in a cyclical way so that they won't get resistance. And topical acaricides like flumethrin and fipronil, moxidectin is generally we use to avoid the tick problems. And vaccination against infectious diseases like rabies, ICH, and leptospirosis, like a common canine 7-in-1 or multivalent vaccines are generally practiced. In 46 to 53, sorry, the number was wrong. So we do a chemical immobilization of the animal to check their samples, and then morphometry, all the recordings, and the vitals, and also the hydration status, and the regular auscultation, percussions, and special procedures like ultrasonography, chest radiography, TB test, dental check, echocardiography, and pulse Doppler, glucose check for diabetes. All those things will be done. And at the second month end, we will be taking a regular body weight, body condition score, is very important. And we definitely not a fan of crush or squeeze cage for sloth bears, because they tend to do a lot of somersaulting and then do a lot of self-injury. So we generally avoid squeeze cages for sloth bears. And socialization with other bears is also established between these 2 months period, and booster doses of vaccine and other necessary treatment based on the blood profile or diagnosed conditions can also be addressed. And the last month, we usually check the compatibility with other animal, and start introducing a lot of enrichment tools, and then practices. And obviously, operant conditioning of individual animal makes much easier once they are familiarized with their environment. And with respect to hygiene protocol, as we all know that we used to keep the enclosures clean multiple times, I mean, especially before food, and then immediately after food. So whatever the number of times we are feeding them, it is important to ensure that there won't be any fecal contaminants in the feeding area, though we are feeding them in a individual bowl or a stainless steel plate to maintain the hygiene. And the good disinfectants, whichever is available locally, can be used according to the vet's preference. And also the meals should also be ensured that it is not spilled all over the enclosure. It should be in a clean, neat place, so that the animal will not contaminate, or even any other excretas will be contaminated with the food and water. So, and I just wanted to touch upon this enrichment, enclosure enrichment, as well as we all know that, which describes how the environment of the captive animal can be changed for the benefit of their inhabitants. So the behavioral opportunities that may arise or increase as a result of environmental enrichment can be appropriately described as behavioral enrichment. And this increases the behavioral diversity to reduce the frequency of abnormal behavior like stereotypy, increase the range or number of normal behavior pattern, that is wild instinct behavior, increase positive utilization of the environment, increase the ability to cope the challenges in a more normal way. So anyone involved in environmental enrichment needs a good basic understanding of the animal welfare and the scientific evidence that environmental enrichment does indeed improve the animal welfare. And highest level of hygiene must be maintained whenever we are using a feed enrichment. So these are some of the stimulations. I like behavioral enrichment, what we usually use: toys, puzzles, varied environments, and helps to prevent stress, which can weaken the immune system and lead to illness. So addressing this environmental enrichment, a lot of behavior and health benefits for any captive animal, especially in and that's a braid feeder, which is like a puzzle feeder. So the animal has to spend some time to pull out the treat from the fire hose hammock here, and then even in the other puzzle feeding, like a ball with a hidden peanut or even the dates inside. So they have to literally express and then come out of their natural behavior to get the treat, as well as they will get motivated to do such kind of activities. You can see it's the best example for establishing their computer skills. Like when we provide a coconut, unopened whole coconut, the bear tend to throw them up and down and throw them against a rock to open and then eat their treat. So it improves their activity as well as engage them to express natural behavior. So these are some of the protocols for the bear health assessment. So we usually check the feed intake, like every time we need to ensure that the monitoring of the feeding is happening on a daily basis by the vet in charge. And the appetite can be easily identified. I mean, the loss of appetite can be easily identified, and based on that, we can immediately get into a kind of intervention which needs either a clinical examination physically or sometimes even after chemical immobilization. And the nutritional supplements, as I already mentioned, it's very important and integral part of this nutrition management of captive animal. The standard body weight will also give a good clue that if they are good, then at least we can ensure that they are physically and psychologically well. And if it goes towards fair or poor, then definitely the veterinary intention is or the intervention is really needed. And then we have to ensure that their body score condition is within the ideal state. And you can see the skin and thin stuffs are daily unwanted or symptom of low nutrition or some kind of illness, even sometimes tuberculosis. But when it comes to overweight and obese, definitely we need to address the activity or even the environmental enrichments, and also the feeding schedule or feeding regime or even the energy level of the food has to be modified or adjusted so that we will keep them in an ideal body weight. And this is another important vocalization clue, which I always insist to the vets. You can hear the sound. It's a bear song, we used to call it, but this song or the sound represents they are very comfortable, and the sound or even the behavior may be encouraging their digestibility coefficient or even the digestibility process. But whenever they stop doing such kind of vocalization, we can always expect, okay, they are not in a good mood, or even they are not comfortable to make this sound. So that is also a part of the sickness clue. So what we understood from the captive sloth bears. And of course, we always have the fecal score is also one of the health assessing tools, and then the various varieties of stool qualities, like even the consistency, color, and then this components. Sometimes even the mucus food or very yellowish or blood mixed or blood tinged, occult blood, or even parasites, which gives us a lot of clue. And then one should establish based on the feeding schedule or the feeding practices of the individual captive facility or the species. And these are some of the common gastrointestinal parasites we isolated, like Hymenopus, Capillaria, and Tricho, strongyloides, and Eimerias, ankylostoma. So these are the common parasites which we encountered. And in our operation theater, we always have a standard checklist so that whenever the animal is on the table, we complete all these practices, starting from basic vital check to blood sample collection to all the parameter checks by using specialized equipments like digital ophthalmoscope, digital otoscope, and also the pulse oximeter and body morphometry, and all the ultrasonography of abdomen or even echo or pectoral, and the chest photography for the individual V marks, because these of late we found and even we established a scientific paper that the individual V mark of individual sloth bear is very individualistic. And then if the by checking or by doing these kind of V mark print, then we can easily identify the individual. So such kind of things are very important. So collect as much as data as possible from individual animal when they are on the table, so that it can be a referral value and the reference material for the future species conservation, and also for a lot of vets to involve in this kind of species conservation in captive facilities. And I really wanted to tell you all proudly that we have contributed in Fowler's 10th volume and then a complete chapter called veterinary medicine in the rehabilitation of dancing sloth bears in India. So we have provided all the 20 years of experience in this 5 or 6 pages. So if anyone is accessing this, definitely you can get more information in this carnivore section 19, chapter 105, about all sloth bear related medicines, and also the transportation cages, all the parameters of blood, and then vital parameters, and also the anesthetic regime, and all the vaccination protocols, deworming protocols. Everything is given in this chapter. So if anyone is interested, I can even send you the PDF form of that chapter. So with this, I would like to conclude, and thank you so much. And I am really proud to enter into the 30th year of Wildlife SOS with long services in handling and then rehabilitation of displaced and injured wildlife of our country. And if you have any questions, I'm happy to answer.
Thank you, Dr. Arun, for your wonderful presentation and for sharing all the experience of yourself and Wildlife SOS. That's a wonderful presentation. There are many appreciations for you on the chat box. There are more questions also. There are 3-4 questions already there in chat box, but we may not be having that much time to respond to. So what we are suggesting is maybe you can just answer the first question, and later we will direct all the questions to you through email, and then that can be circulated with all the participants later. So the question reads like this. This is from Dr. Nirupama. Very nice presentation. I have 2 doubts. Is there any transfer of disease, TB, from infected bear to non-infected bear? That's question number 1. Question number 2 is also, how do you administer the medicine? Duration of medicine. Do they accept the medicine every time? So, please, maybe you can give a short.
Yes. That's a very nice question, Dr. Nirupama. I appreciate it. See, this is basically the reverse zoonosis what we are facing in this dancing captive sloth bear. So we could not prove that they are transmitting from one animal to other animal, because this is not Mycobacterium bovis. Though Mycobacterium or even tuberculosis in general is an aerosol infection, but we are not able to record any such kind of evidences that a bear has actually gone from non-infection to infective stage. And many a times we have seen infective stage to non-infective stage they have moved to, because we always give them this prophylactic anti-tuberculosis drugs. As I said, this isoniazid, rifampicin, ethambutol, and pyrazinamide combination. And as per the human pulmonologist, because this is the human tuberculosis, which is Mycobacterium tuberculosis, so we took a lot of guidance from the human pulmonologist, and then based on their version, what we are currently following is weekly 3 days regime of anti-tuberculosis drugs to all the animals. And then we are very much in control of this disease, especially in our captive animal facilities, because we have multiple numbers. Like in one enclosure, in one rehabilitation center itself, we have 100 animals. The other place 60, the other one 40, the other one 30. So with this large number of populations, it is very, very difficult to say that whether they are contracting the disease between individuals. But still, we are keeping them in group quarantine practice whenever we are suspecting someone has died of tuberculosis, especially after their geriatric age, like 20-25 years. So we always keep them isolated, and also ensure that the other animals are all getting this a prophylactic anti-TB regime, like 3 times a week for 3 months. So this will be the regime what we are following as per the human pulmonologist, and we are getting better results, and we are not losing those many bears until or unless they are really, really aged, and then there are multiple vital organ dysfunctions, which leads to the stress, and then that stress leads to increase in the tuberculosis infection. And your second question is whether they accept the medication or not is a very big challenging question, and it is challenging for us to even make the animal to eat the medicated food. But of late, we have got these medicines, anti-TB medicines of pediatric use, which is really a nice flavored tonic base. So now all the bears of our facilities are accepting that. So that is the big boom for us, because previously when they were pills, they were refusing to eat, and then they refuse the food for weeks together. So generally that leads to stress. So we again resume the medication out of the food, and then they take only the plain food. But now with this syrup form, they are all eating the anti-TB drugs, and which is very much ideal because it is meant for babies. I mean, the human infants for this primary complex or even tuberculosis, early infections in kids, in human beings. So that particular form of the medicine, what I mean is this syrup form is very much acceptable by these animals.
Thank you, Dr. Arun. There are a few more questions, one from Jacob and Dr. Azad, Dr. Jacob and Dr. Avjit. I will direct all those questions to you through email, and later we'll just circulate.
Sure.
This has to be done because for want of time, we need to just... Thank you so much. Thank you very much for your presentation, and you'll be getting more questions, I suppose. Now I hand over the mic to Dr. Hayden.
Thank you. Thank you very much, Dr. Shah. Very interesting presentation. We very much appreciate that. Our next presenter is going to be Dr. Bushra Nizar Khan, who is an assistant professor of zoology at the University of Punjab in Pakistan. Dr. Bushra's research interests are in conservation and management of wildlife, animal behavior, non-invasive diagnostic methods, environmental toxicology, wildlife microbiology, captive wildlife stress management, ecology and natural resources, and sustainable management. And Dr. Bushra is going to present today on non-invasive diagnostic techniques and stress-free housing of animals. So Dr. Bushra, if you could please share your presentation. Thank you.
Thank you, Heidi, and thank you, Daniel, and all the Indian Asian Wildlife Trust. It's really an honor for me to be there and share my knowledge is at that wonderful platform. I'm really very obliged and feeling so high to be there. Is my screen is visible to everyone?
Yes, but you can just make it full. Yes, now it's fine.
Okay, thank you. Dr. Heidi gave my very good introduction, but I would also like to introduce that prior to Punjab University, I was part of the Lahore Zoological Garden till at my early career life. And that's why my love for the captive wildlife and for the welfare of the animal is very vital for my life. And I wanted to wonder and also want to put some level of comfortable for this captive animal. Now I start. Bismillahirrahmanirrahim. In the name of Allah, the most merciful and beneficent. And I am Dr. Bushra Nizar Khan. And today I'm going to talk with you all people and try to share my research, especially to reduce the stress in captive housing animal. And I am more in the diagnosis of non-invasive diagnostic techniques. Here I want to share a video of some animal that replenished my memory when I was working at Lahore Zoo. Please have a look. Absolutely. Thank you. And one thing I missed is the wonderful and excellent presentation of Dr. Arun. Dr. Arun, it's wonderful. And I am so thankful to you for sharing such informative knowledge with us. Now here we move toward the role of the zoo from the 19th centuries towards the 21st centuries. Earlier in 19th centuries, the zoo were meant for old-fashioned menageries where we kept animal just for the viewing the animal and keeping animal. Afterward, in 20th century, they become more toward the zoological park, living museum. But in 21st century, zoo are meant for the conservation, education, management, and research. And it is the duty of the 21st century's conservationists, zoo handlers, wildlife managers to make animal in captivity more happier, more close to their wildlife, wild nature, and stress-free. Okay, these are the old-fashioned menageries, and now we are seeing zoos at that level, and they should be like that. And we are trying and aiming to making our zoos like that and making our animal happy over there. As far as Dr. Arun gave very good presentation regarding the stress of the animal, of the bears, and we all are very much familiar with this factor that in zoo, the captivity is a big stress. And other way, the zoo are the place for keeping animal at the scenario when their natural habitat is at a destruction, facing destruction, and many other problems that are basically created by the humans. So at that situation, zoos, wildlife parks, and some SOS can play a vital role to protect these magnificent creatures of the nature and saving this wildlife for our ecosystem and for our coming generations. The stress is very vital and it is very obvious in the zoo, and they impact the animal in many ways. It can impact its body mass, glucocorticoid concentration, its responses, reproductive success, immunofunction. And at the moment, the use of enrichment is very vital to compensate or to mitigate these stress responses. And here we have introduced a aromatherapy, the method to reduce the stress or to reduce the plasma cortisol level, especially in zoo animal, especially those zoo animal that are living lonely or the singly captivated in the cages. And we use the fecal matter and we apply the enzyme-linked immunosorbent assay ELISA to identify their ELISA concentration, and we also correlate their behavior with this concentration of the cortisol. Here we use the short-term aromatherapy. Aromatherapy is very famous around the globe for treating the human behavioral disorders, to reduce the stress, to improve the sleep cycle. And one of the very remarkable oil that is very famous in human beings or even in child for their sleeping, for their calming, is the lavender oil. And keeping all this in mind, we tried these oil to enrich our zoo animal, and we use here in our current research 4 essential oil: the lavender oil, the eucalyptus oil, the lemon oil, and the peppermint oil. And these oil we have imported from or buy from some oil company, and they were in the packing of 30 ml bottles. And what we have done for this purpose, we selected the Lahore Zoo small cat section, where these 5 animals are lonely captivated, like the Asiatic lion, common leopard, striped hyena, jungle cat, Asiatic lion, and the wolf. And this is their current health status. Among them, 3 of them were the zoo-born, and 2 were brought from the circus, and one is the wild confiscated. The more noticeable thing over there is their cage direction or the area. As Dr. Arun previously indicated, the cage is very important. The size of the cage is very important for the well-being or the welfare of the animal. And among these breeding, you can see the cages provided to them are very small and not so enriched, with the lack of some plantation, some area for move, walk, and exercise. Furthermore, I will show you their pictures as well. And we started we prepared a small ethogram for focal monitoring of the behavior of lions and tigers or all the animal in under studies. And in this category, we observe the three behavior: the normal passive, normal active, and stereotypic behavior. And these all behaviors are furthermore classified and explained accordingly. Here you can see the cage of the Asiatic wolf, and you can see the pathetic condition of this cage. This outer is just its area for its walking, and the back room is used to keep this wolf during the winter days or during the sunny days to keep from the climatic condition. And this is our jungle cat, and the same, because all the enclosure in these sections are of this same condition. In such conditions, they need lots of enrichment, and they need lots of interaction with things, because first of all, their cage is not of good condition, and secondly, they are single in their cage without their companion. It is the common leopard. This cage is a little bit bigger as compared to the previous one. And this is our Asiatic lion. And here we have the type hyena. And the overall period of the research is divided into the three phases: pre-enrichment, post-enrichment, and the post-enrichment. During the pre-enrichment, we just observe the behavior of all organisms for 1 month. Then we gave them the enrichment with the help of the aroma, and for 3 months, for 10 days, we gave them the enrichment for 10 days, and gave the break of 10 days to start the next oil to assess the impact of that oil on their behavior and on the cortisol concentration. We spread how we make the concentration. We make the concentration in 1:6 ratios. We dissolve 2 ml of the oil into 14 ml of the into 12 ml of the normal water, and the whole concentration was 14 ml, and we spread this oil on the bench, on the barks where possible, where the some wooden log, some branches, some places are present. We spread these oils over these areas, and after that, the fecal sample were collected. We use generally the simple dehumidified technique when save these into 80% methanol, and after collection of the all sample, we run the ELISA by cortisol ELISA kit. And we observe 2 types of the behavior over here. One is the frequency, and second is the duration of the behavior. These are the fecal sample of 5 animal, and these are the multiple steps we done during the estimation of their. And what are the results? Results are so wonderful. You can see over there the different type of the oils and the concentrate and result. Like here, the green color is indicated by the lavender, yellow with the eucalyptus, lemon oil, and the peppermint. And we can see in pre-post test the very excellent result of their behavior. These are all stereotypics: normal, passive, and normal, active result are clear, or it can show over here. And again, we can say the result of these oil on the cortisol concentration. And I can show in this new video that how they come. You can see this wolf is clearly making the sign of 8 when it is moving in its cage. So it is the highest level of distress which we can see by this video. And we are very happy that after the application of this small aromatherapy, its moving is controlled. The wolf is starting sitting over there, and apparently, and even with the result of cortisol concentration, we have seen that its overall well-being was improved. Again, we came with the jungle cat. Jungle cat, as the matter of fact, not very obviously give great result. The jungle cat was more irresponsive of these oil, but still there was some result that are indicating that the aromatherapy has affected them. And also there is also a prominent result in its concentration level of the cortisol as well. Here you also can see its video. When they open the night cage after cleaning, as she entered in the cage, she starts smelling, licking, and of the area of the wood where we have spread the oil, and it was a positive sign that the cat is responding to new entry in the cage. And she, in all the 10 days, whenever she came from the inner cage, she was searching for that particular smell. She want to smell that aroma, and she was also looking attentive and responsive to that new change in the cage. Again, we are moving toward the common leopard, and here you also can see some changes in their different kind of their behaviors and the impact of different oil on their behavioral parameters and even on the concentration of the cortisols. The wolf was also so much responsive to this oil, and when it come from its inner cage, the leopard started smelling, becoming attractive, and during other days before enrichment, the leopard was used to move here and there, but during these all 10 days, the leopard used to come over here, the leopard smell it and feel happy, apparently. Then we move toward the Asiatic line. Here we also observe a good results with the application of this short-term aromatherapy. And when we relate their focal monitoring of the behavior with their cortisol concentration, the result was very positive. Striped hyenas, again, very happy. Here you can see serotypic behaviors and its normal behavior and normal active behaviors. And again, the result of the cortisol concentration. And in this video, you can see its responsiveness toward this oil therapy. So it was a small talk and it's a small activity, but we found very good result. We used 4 oil altogether, and we found the lavender at the first, then the eucalyptus, peppermint, and lemon at the end. After application of the oil or after the post enrichment period, we feel that the impact of these oil remain on the organism for 10 days after the aromatherapy. And after these 10 days, we again observe some abnormal behavior, less activity in these organisms. So on the basis of this, we recommended that the aromatherapy can improve their behavior, their activity cycle. It also can reduce its movement or its abnormalities. But the zoo or the management that is dealing with the animal care, the veterinary staff, the keeper, and all other relevant people, they should plan a proper aromatherapy enrichment for the organism, and it would be very useful. And we recommend same again, the employer size, vegetation cover, pairing of the animal, and natural environment provision, proper enrichment plan. Thank you very much. These are my few publications on animal behavior and aromatherapy and different kind of the other activity I have done for the improvement and betterment of the captive animals. And here's my contact list. Now, thank you very much for listening me, and the house is open for the question. Once again, thanks again to Asian Wildlife Trust, Heidi, and Dr. Daniel. Thank you very much.
Thank you, Dr. Bushra, for your wonderful presentation and for just trying all these essential oils that can just give good behavior of the animals in captivity. And now it's time for questions. If you have any questions, you are most welcome to ask. We can, there is one question from Dr. Nirupama. I will read that. Thank you for the presentation. I wanted to know how you tried in captive elephants, which show more stereotype and monkey okay, sure. And monkey who kept as pet, leading to behavior changes. So Bushra,
Sorry.
yeah.
Sorry, she is asking about the study in monkeys and elephant.
Yeah, monkeys and captive elephants. Yeah.
Captive elephant, yes. We have one African female elephant, the Susie, and she was died like 6 or 7 years back. And at that moment, when I was at zoo, we also used some aromatherapy, scent therapies. Even we involved our elephant in painting, and we felt that the behavior of the Susie is very much improved. And same the way as we talk about the monkeys, at that moment, we also for monkeys we use the puzzle feeding, we use the frozen delights, or and we also use some kind of the hidden toys for them, and they were so interactive and happy at that time. But as I told you, currently I am not in Lahore Zoo. I am in Punjab University, and I am an assistant professor. So now what I'm doing from here to make those animal happy over there, I do or plan my research work on for welfare of these organisms. My students of MS, MPhil, PhD, we are basically the all theme or all the basic component of my research is to make the captive animal happy, whatever the condition and how it's possible. Thank you.
Yeah. Thank you, Bushra. There is one more question for you from Dr. Selvam. And he says, good presentation. What about result in lion, tiger, etc.? Lion and tiger.
Lions and tiger, yes.
Yeah.
Our recent paper was on lion and tiger in Lahore Zoo Safari. In that work, we use two types of the aromas, but that the both were natural. One, we use the giraffe zebra dung. We pick the zebra dung from the cages of the zebra and put in different position of the lion houses, lion safari and tiger safari. And second thing that we use is the catnip. Catnip is the herb that is very liked by the wildcats. They love it. We make the small bags of the catnip and also hide these bags into different cages, rocks, and dens of this carnivore. And we found that there was also a great result with this kind of aromatherapy with the lion and the tiger. But as compared to tigers, the lions are more responsive to these kind of the aromatherapies as compared to the lion. And secondly, when we compare the effect of aromatherapy in the zebra dung and the catnip, we found that they were more responsive to zebra dung because the zebra dung enhanced their predatory activity, and that was very useful to reduce their stress.
Yeah.
Thank you.
Yeah. There is similar, and Dr. Ash also the same kind of question. So that is answered. There is one more question. Thank you, Dr. Bushra, for the good presentation. We are going to apply aromatherapy in our zoo. So he just complimenting it. Yeah. Thank you. Yeah.
Thank you. Thank you.
Yeah.
Thank you.
Over to Heidi now. Yeah.
Yep. Great. Thank you very much, Dr. Bushra. Very interesting presentation. We appreciate it. Thank you. So we will move on now to our final presenter. Our final presenter from Indonesia is Dr. Lois Shura, who's a veterinary surgeon and has been for the past 10 years of experience with the Indonesian Wildlife Rescue and Rehabilitation Centers, as well as a wildlife lecturer at the Wildlife Studies Department of the Veterinary Faculty of the University of Syakwara in Aceh, Indonesia. She is also a visiting lecturer for the veterinary faculty in Utrecht in the Netherlands and founder of the Vets for Welfare Foundation. Dr. Shura today is going to talk about insights in veterinary care and evidence collection of exploited wildlife. So Dr. Shura, please share your presentation. Thank you.
Thank you very much, Heidi, for my introduction. Let me share my screen. And I hope I am loud and clear for everybody.
Yes.
Thank you. Thank you, Danielle, for acknowledging that. I am very grateful to be invited to do this presentation. And I hope that some of my students from the University of Jayakwala have also joined. I'm not sure, but they might recognize some of the slides that I will be presenting today. So my major interest goes to veterinary care for exploited wildlife. I'm a graduate from the University of Utrecht in the Netherlands, and I've had my own practice. So I'm a clinician by birth, but then I moved to Indonesia and I was started joining the veterinary work for an NGO called Jakarta Animal Aid Network, who work all over Indonesia. And I saw from 10 years ago, starting to see all the things that are happening within Indonesia. And I acquired a lot of knowledge about wildlife from that. And I try to combine it with the practical knowledge from having my own clinic and how to deal with all these animals. And now today I've become a wildlife lecturer at the University of Jayakwala in Banda Aceh. So wildlife health and welfare is the topic of today, and it speaks to our heart. Not for nothing, my own foundation is called Vets for Welfare with the 4. I would like to share some of the insights that have come from all the experiences that I have found from the past years. So Jakarta Animal Aid Network, or JAN Indonesia, is all about wildlife protection. They do not specifically rescue one type of animal, but they rescue everything basically that needs rescuing. So that is where there is diverse animals that have crossed my path, whether it's dancing monkeys or expats or social media victims, or wildlife traffic victims, or human-wildlife conflict victims that they are asked to rescue. They rescue them, and they eventually end up on my table and on my colleague's table. So I call all of these in one word exploited wildlife. Now, it's a difficult business, the rescue business. What they do is they rescue and then they try to rewild what can be rewilded, of course, because some end up being permanently handicapped and find a sanctuary within their rescue centers. But eventually they try to release the healthy ones. Now, this takes time, as everybody knows who works in rescue centers. Now, the veterinary care is very specific for these animals. And I've dug up my references, and I should update my Fowlers because it's now volume 10, as the first speaker already noted. And I'm really looking forward to reading that chapter on the sloth bears. Another go-to for me, almost on a daily basis, that I would like to share is the Transmissible Diseases Handbook from the European Association of Zoo and Wildlife Veterinarians. You do not have to be a member to access that handbook, and it has short fact sheets on all the diseases and zoonoses that we encounter as veterinarians. It's been very, very helpful. So of course, with every animal that enters our facilities, we need to do disease monitoring, and the first thing we do is quarantining them. And then there's also the aspect of animal welfare. And what I my insight basically is that every time we were confronted with a rescued animal, it was basically a crime scene. So if you look at the last report of the World Wildlife Crime in 2024, they've got all the numbers of seizures recorded between 2015 and 2021. What you see is that you see a decline in the animal parts that are being trafficked, but you do not see a decline in the live specimens that are being trafficked. And that is where I want to talk about today. So the illegal wildlife trade, of course, hampers any effort that we do as veterinarians to help the One Health situation. It disrupts ecosystems. So it is a big, big problem. So if you see a dead animal or dead wildlife in Africa, the crime scene is usually this. So you have time to do a necropsy, take notes, take your samples, and do everything. Within Indonesia, usually the crime scene looks like this. It is boxes of live specimens that are being trafficked either in buses or other vehicles. And usually these calls come in the middle of the night or at moments that you do not have all the manpower in the world. So this is from a crime scene that we had a couple of years ago, and you can imagine how overwhelmed everybody is if you look at the amount of boxes and the amount of live animals that are in it. So it's basically where I started thinking about where do you begin with this? Because every box you open, there's a different species in it, whether it's a primate or kucing hutan, as they call it, or it's birds. They usually end up like this. And as you can read in literature too, there's an enormously high mortality rate in these live trafficked animals. So it felt like this. It felt like we were just mopping the floor with the water just running on it. It felt very demotivating. And that is how we try to do something for these confiscated animals. How could we improve their survival? So if you look at the timeline of confiscated live animals, basically there's an arrest with all the authorities, then the customs need to do all the paperwork, and eventually you hope they end up in your rescue center, or if the authorities release them, they are released. So it is a timeline that takes time, and unfortunately during this time a lot of them die because obviously this is not a good situation for them. They are either hyper or hypothermia. In this country, of course, hyperthermia is more of a problem. They are dehydrated, and this is a cycle of stress that we don't know how long they've already been traveling for, but how do you get the moment that they are arrested towards the moment that they enter your rescue center? How do you make basically their rate of survival as best as possible? So we were lucky to get a grant through the IFAW, through the US Department of State Bureau of International Narcotics and Law Enforcement Affairs. And we were asked to make a guideline basically for these customs first responders. And what we did, Jan did in Indonesia, the Jane Goodall Institute and Legal Atlas did it in Guyana and the Congo. So we basically wrote this guide, and then we gave in 2023, we gave several workshops to the people, the authorities who are actually the first responders. We also gave them a kit so that they always have a kit ready that they can take in cases of these confiscations. So we trained them in the basic rescue and care. What did we do? Well, be prepared to wear protection, right? Always wear your personal protective equipment, because you need to be protected from the wildlife, but you also need to protect the wildlife from you. Also, in cases like this, get rid of those predators, because they will give more stress to the animals that are kept in those boxes. And we taught them a bit about where is hyperthermia and when is it hypothermia. And there's a lot of literature you can find on the transports of animals in cold situations or in hot situations. And then you realize where the victims will fall first if you don't do anything about it. So we taught them that ventilation is a really easy way to enhance by basically stacking the crates in a different way. So this would already give them a better outlook if you give them a better ventilation. Also to start rehydration, but then we didn't want them to come into contact with the wildlife in these boxes. So we optioned for a simple, fast way, which is always available everywhere. And it's just pressing cucumbers or watermelons or bananas through the holes in the boxes. So the most effective way for survival of multiple victims, of course, all depends on the amount of resources you have, the amount of manpower, your facilities, the experience of the people giving the first responder care. And of course, stress reduction is a big one. So thermoregulation, rehydration, ventilation are things you can do easily. And then, of course, once they come into your center, then you need to do patient triage. So that was the first insight I wanted to give you. The second one is really interesting, and I think there should be more evidence-based research into this, because what are the tools that we can help as veterinarians to improve successful prosecutions in future? If you look at some of the prosecution rates in Indonesia for the crimes that are being done, but are these prosecutions all ending up into successful verdicts? Is there enough evidence to come to a successful conclusion? And this is where us veterinarians can help. So what you need to know is that only evidence that has been collected, transferred, and analyzed in a correct and chronological manner will be accepted in court. But lucky us, we are veterinarians and we are used to working in a systematic way. So if you look at the opportunities where we can gather that evidence, it's of course around the arrest, but that is for the police or the customs, right? That is the car, that is anything that is in that vehicle, that is questioning that person. That is not our expertise. That is what we do not do. But where we do come into collecting some evidence is when we are called to help during that time when they are in sort of a transit to your rescue center, and obviously when they enter your rescue center. Now, all this evidence can help in the current arrest that they're doing, but it's also can be very valuable data for future arrests and to collect insights into this illegal wildlife trade. Because if we heap up all that evidence together, we can have more insight into where are the big bosses who are involved in this illegal wildlife trade. Now, once they enter your rescue center, you, of course, are in control. The rescue centers are the holding centers for the confiscated animals during the legal process. The animals are the evidence, of course, but the animals' live bodies change over time. So it is crucial to do an inventory on arrival. Now, we all know that when they arrive, it's all a matter of their health, nutrition, housing, and it's very species and age specific. As you also already saw for the sloth bears right? It's so species specific. But now you have all those boxes with every type of species that you can imagine. So how do we do this? What is relevant and how do we do it as veterinarians? Well, we already work systematically. So your systematic documentation that you do as a veterinarian can be crucial. And I already saw in the presentation some wonderful photography. That is evidence. Now, the animal's body also holds the evidence. So we need to develop more innovative new detection tools that will help us to stop these wildlife criminals from being able to do wildlife crime. So this is your record. And I already saw from the sloth bears that they're already recording everything. I saw beautiful photographs. Now, if you make a photograph, it is always good to put a reference. We all have injection needles on us usually, so that a syringe would be a wonderful reference. But you can also use a coin or anything else as a reference. Try to take clear pictures and go from overview to detail. Also take them at a right angle, so not to get in a wrong situation where something looks bigger or looks smaller than it is. So as you see from these files, I've designed some files where you can draw on the animal's picture. This makes it very easy, especially if you have a lot of animals to deal with, to do it in a very simple and very fast way. Also, the tick boxes work very well, so you can see where you are in your whole veterinary investigation. So this is purely your systematic way of looking at the animal. Your veterinary way is already your evidence. Keep all your notes and upload them to a drive, a Google Drive or anything online will do. Just keep it. So why are we doing this? Because there are loopholes within the system. Is an animal traded legally when it's bred, captive bred second generation animals can be legal to trade? Or is it an illegal one that has been captured from the wild? Have the papers been rigged? Have the papers been changed? So a nice investigation into this and a nice new tool that I would like to point out to you is one that was developed in Hong Kong by Ms. Astrid Andersen et al. So she looked at the kakatuas. Kakatuas originally come all from Indonesia. Now, there's some kakatuas that apparently live in Hong Kong in a park. Now, she took a feather, merely a feather from all these animals, and then looked at the isotopes. And from these isotopes, she could see which ones were from the wild and which ones were kept, so locally bred. Now, this is important because if you have forged paperwork and you have evidence that points like this animal was not from a breeding station, this one must be trafficked from the wild, then this is clearly a very good evidence to put together for your court case. So the evidence is within the animal. And some of this evidence has been found really good at predictive accuracy. For the turtles, they took a little bit of their carapace, and then they found they could accurately predict if it was wild caught or bred, even with an accuracy of 97.2%. Now that is very powerful. Now, there are more things out there that we veterinarians can have a look at. We just need the resources to do that. But think of feces samples of snakes. Most of the snakes that are wild caught harbor a lot of parasites, but the ones in breeding centers are being treated, so they don't. Another one is blood parasites in birds. A lot of the wild birds harbor blood parasites. The ones that are bred in breeding centers shouldn't harbor these. But these two haven't been scientifically yet proven, but they are anecdotally named in literature. What has been, as you saw in the article of Anderson, that the feather sample for Kakatua can give you a really good, trustworthy clue of, was this animal wild caught, or is it truly from a breeding center? And so are nail or cavus samples from turtles. Now, the next thing that we are doing with a nice grant from Wild Animal Initiative, we are doing this together with the Utrecht University and Universitas Shaya Kuala, is testing if we can use hair as a long-term stress monitor. Cortisol is, of course, you can test it in blood, saliva, feces, but it's also deposited in hair and in feathers as they grow. So it gives a long-term calendar of stress. And of course, we can compare wild animals with the ones in breeding centers. So this is something that we are trying to establish. So circumstantial evidence that is reported, it all stacks up to one thing. It all stacks up to hopefully a successful prosecution in future. And that is what we veterinarians can do and help to prevent these crimes from occurring and all these animals from dying. So take home messages for today, use a structured approach as we all already do as veterinarians. Stay within your expertise, of course, wear your personal protective equipment, and have an emergency bag ready, because that call to help with wildlife that has been captured can come at any time. And take and store your samples for futures. Thank you very much.
Thank you, Dr. Shia, for your wonderful presentation. It was really many of the tools that you just presented, so many of the examples that you gave, very useful. I'm just wondering whether we can use some of these methods for the identification of certain invertebrates that are on trade. So I will ask, is any kind of tarantula on trade in your region? Tarantula, like large-bodied spider?
I haven't seen them being traded, but probably yes. You never know when you open a box what is in it, but so far no tarantula.
Okay, yeah, that's on big trade. Is that in the CITES list? So
yeah, but interesting. That would be another tool to look at, basically, to distinguish between wild caught or bred species, right?
Yeah, exactly. And people who are keeping as a captive bred, and they say that's all from captive.
Exactly.
But mostly these invertebrates cannot be bred like that. It'll take a long time, and it's very difficult to just. So there should be some kind of replenishment from the wild, and it'll be wonderful if any of the isotope studies that you did will be of great, or your team did will be of some tool to do same kind of work for invertebrates, especially the tarantula. Yeah, because they are on big trade, and many of the species are highly threatened and critically endangered too. Yeah. Yeah, thank you very much.
Thank you.
Yeah. Any questions from the participants? Any questions? A lot of, there are a few appreciations from some of the people, and they say that very impressive and eye-opening talk. Yes, it is also my field work. Dr. Bushra has just mentioned that use of feathers to monitor stress. Yeah. Any other questions? If there is any question, we'll be more than happy to take it. You can also, yes, please. Dr. Rosella, you can ask. Maybe she's typing. Yes. Yeah, there are a few questions for you. The first question is from Dr. Rosella. What is the biggest challenge during your work in Indonesia?
My biggest challenge, wow. It was getting to, so there was a point where me and my colleagues felt confident to address the species that you find within Indonesia. And then we suddenly encountered species that came from abroad. That was sort of a shock for me, that after learning and delving into how to address the medical part and the housing and the nutrition of the Indonesian species, that we also needed to acquire the knowledge on these species that are not found within Indonesia but are traded too. That was, I think, the biggest shock for us at that time. But I see that there is a level of care and starting with my students from Shaya Koala, that they are very interested in stopping this wildlife trade. And I also see that the authorities are also more and more going into prosecutions. And what I like to give my students to help them, basically, because it's a very stressful situation if you're called into dealing with all these animals that are in such a bad condition, whichever exploited wildlife it is, for your mental health as well, that there is something you can do. Even if you have little resources, even if you don't have a blood analysis machine or an X-ray or whatever in your center, just with simple documenting, systematic work, you can do a lot. So thank you for that question, Rosalia.
Yeah, there is one more question I will just read. It's from Dr. Neerhak Oak. And what disease screening tests do you use at your center, especially during preliminary examinations?
Yeah, so it all depends on which species we have. Like we had a confiscation with 1,200 animals at the same time, which were and birds and civet cats and kucing hutan, and I don't know, there was like monkeys. It was so many types of animals. Normally, when we have less animals, we start the quarantine procedures immediately. But now we were so overwhelmed that the first things we had to do was giving them better housing than those boxes that they were in. So that was the first days that we started redesigning and restructuring our whole center. And at that moment, basically, our whole center was turned into a big quarantine space. Now, in general, for primates, we do tuberculosis monitoring, of course, every 2 weeks, 3 times, and blood and fecal samples, etc. And of course, body scores. And for birds, we do of course, the monitoring, the swabbing of the crop and the cloacas, and send in for AI and ND. But when you have like 900 birds at once, you need to do it. You can't do all of them. So you have to also the research sources count, right? Because our rescue center depends on donations. So you have to be smart about it and immediately start organizing this and then taking samples from like 1 from every box, but careful monitoring, depending on how many people you have to help you. So we made a bird team basically of 3 persons, and then we hired girls from the village around us to help us with all the infants, because it was all infant monkeys and civet cats and the cat-like, and also to parrots, infants. So we had to be very versatile and very flexible. But that is basically the screening came along very fast after that. Yes.
Yes, there is one more question. What preventive medicines are more focused on newly rescued, confiscated animals? As you previously mentioned, many animals die during transport, and they are on stress as well as different changes in their body psychology, physiology, nutrition is most, and then other preventive care during quarantine.
Yeah, my go-to always is deworming. I love deworming. I can't help it. I think there's lots of scientific evidence that wild animals caught from the wild harbor a lot of parasites, and because we deal with in this wildlife trade with a lot of infants, and they are very, very vulnerable to parasites. And I don't want them to start contaminating the environment that I put them in. And because also we never know how many come in, you have to be very careful to keep the spaces that you have very clean and work very hygienic. So that is my number one preventive medicine, I guess. Yeah, and then of course it is the monitoring of the animals, and that is smart organizational. With I usually start drawing on the windows, to be honest, to keep track of all the animals, because the papers that people carry in their pockets get wet, your hands get wet, you do not have time to jot it down. And then windows and doors are a very good kind of filing, basically, to start with. And you try to organize the boxes that come in. I start coding them. So I just use like numeric, like 1, 2, 3, 4, 5. And you try to keep track of which animal came from which box. And also, of course, you need to do triage always, because which box are you going to handle first, right? Is it the one that contains all living ones? Is one that contains the half dead, half living ones? I mean, the dead ones you can shove aside. But so I always teach my students, if you start putting your time and resources into that box where they are already dying, then by the time you get to that box where the animals are all alive, they will be in that same dilapidated situation. So it's better to, within triage, to focus on the boxes which holds all the animals that are alive, and put them first in a better situation, and then put your intensive care in time, basically, and resources into it, and try and save as many as you can from the boxes where the animals are already dying. I hope that answers your question.
Yeah, there is another question following up on this question. Apart from deworming, is there any other prophylactic medicine which you use? Not necessarily antimicrobial, perhaps from the ethno-veterinary medicines.
Yeah, basically vitamins and iron. I see a lot of low red blood cell counts, especially in primates. And of course, with infants, hydration is your number one. It is very difficult sometimes to get them to start feeding. They are, of course, we don't know how long they've been on the road, but sometimes you can see it from the amount of feces that is left in the boxes, and it's been a long time. and these babies all have to adapt. And there we have some tricks of, for instance, for the feline infants to put some AD Hills. I think everybody is familiar with that concentrated food, and we put a little bit in their milk, and that will make the milk so delicious for them, and that usually gives them the boost to start. Yeah. So of course you always start rehydrating with an ORS type of solution if you have it, and otherwise you have to make it yourself before you start feeding anything. Rehydration is yeah, I think the most prophylactic medicine that you can think of.
Yeah, thank you, Doctor. And there is one more question from Dr. Nirupama. What type of disease? Oh my God, it's moving very fast. Okay. Okay. What type of disease you have
Can you
seen
hear me?
in infant monkeys in rescue center? Hello? Looks stuck, huh?
Can you hear me? Did I lose
That's-
contact?
Yeah, there's some problem. We can hear interrupt. Can you talk, please? Hello? 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 I think there's some serious problem with connectivity. I think there's some problem with the connectivity. So maybe we can just, type, direct all these questions to Dr. Lois after some time. And then if you have any questions, even after we close.
Did I lose contact?
Yeah. Hello? 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 Yeah. So we'll just, direct all these questions to Dr. Lois, and then the answers will be just circulated both in the group as well as through email as well. The time is almost 5:56. Heidi,
Can you hear me?
Hello. Yeah, now we can just see and hear you also.
Yes.
Yeah, okay.
Good.
So maybe
I'm
we have
back.
few seconds for to reply. So the question is, what type of disease you have seen in infant monkeys in rescue center?
Yeah, lots of infant monkeys, especially the expats, they come dehydrated and they've sort of given up on life. I see fungus, I see parasites, but it's and sometimes they even have clipped their teeth. So a lot of pulpa infections, fistulas. I've seen broken bones, especially metacarpalia or metatarsalia. I've seen bullets lodged in their bodies, and we think that is from the mothers that they capture or they kill to get the infant from them. Yeah, diverse herpes, of course, a lot of herpes going on within the monkeys. But yeah, especially I think that a lot of monkeys that are being sold as pets, to be honest, that they don't make it that long, that they stop eating and drinking, become dehydrated, and then die. So if the monkey's lucky, it ends up in our center. If it's unlucky, it dies. Because the amount of animals you see that they are selling, I do not believe that there's so many people buying them. I think the death rate is enormous.
Okay. Thank you. The last question from Dr. Rosella to all the speakers. She says, based on your experience working with wildlife, have you, your colleagues, contracted any zoonotic diseases? If yes, what are they?
Well, it wasn't working with wildlife. It was actually contracting fungus from a kitten that I rescued from the streets of Jakarta. Not from wildlife.
Okay.
Maybe I was careless with the kitten.
Okay. Yeah. Okay, the last question, I suppose. May I know how you would approach expert primates with behavior issues?
Yeah, so there is Jan, Indonesia has a lovely rescue center where they have a rehabilitation that is tailor-made for these monkeys. Basically, what we do is we first, of course, they have to be healthy, number one, right? And disease-free before they go to the rehabilitation center. There we build basically a new family for them. So we give them a stepmother, stepdaddy, step cousins, step auntie, step uncle, and we build a new family. Now, what I usually see is when I have taken care of them and they're really directed to me, once I bring them to the center and I introduce them to their new mother or daddy, that the days after, they do not want to come to me anymore. So they ignore me. And that is, I think, a very good sign. So they start to learn how to be monkey again. And that is a very wonderful thing to see. So also you see some coming in with thumb sucking and all these behavioral issues. And you see those type of issues decline to the center that they don't know. Then suddenly you see one somersaulting again, but it's triggered by human beings. Yeah.
Okay. Thank you. Maybe this will be the last question, but in our this is from Dr. Nirupama. In our rescue center, we see the infant getting diarrhea, emaciated, but appetite will be there, and they die. How do you see anything like this? Have you seen anything like this?
No, usually they also lose their appetite. I have a question then. Anything? And which type of monkey is it?
Bonnet macaque.
And the Columbine monkeys, Oa gibbons?
Bonnet macaque.
No, they usually lose their appetite before they die. So it's a question of what was the cause of the diarrhea. Interesting.
Okay. Yeah. Okay. Thank you very much, Dr. Lois Schur. Thank you for your very, very interesting presentation, and you are doing wonderful work there. And now I request Heidi to just, give some announcement and then just close. Yeah. Over to Heidi, please.
Thank you, Daniel, and thank you very much to all the presenters today. Very interesting presentations. We really appreciate it. We will be posting the link to the recording on the Asian Elephant Support website so that other people can listen in if they were not able to join today. The next webinar is going to be December 11th, and it will be mostly elephant health. So we hope you can join us then. And until then, thank you very much to everyone, and we're glad you were able to join us. Thank you.